everyone, welcome to Medical Frontiers. I'm nutritionist Erica Angel, and the footage you're seeing is from this state-of-the-art endoscope, which is being developed in Japan. It uses artificial intelligence, and in an instant, it can detect colorectal cancer, which has killed almost 900,000 people worldwide last year.
Japan is a world leader in cutting-edge medical technology and healthcare services. Join us as we explore Medical Frontiers. Since March 2019, medical professionals in Japan have been using an AI-powered endoscope for colorectal examinations. Shin'ei Kudo developed it together with a Japanese optical device maker. He has diagnosed more than 350,000 cases worldwide and is a global authority on colorectal cancer. The AI-powered endoscope is about 13 millimeters wide. Doctors insert it through the anus to examine the inside of the patient's large intestine. An endoscopy is an effective way of detecting cancer at an early stage. People with colorectal cancer may not realize they have it until it has progressed. In 20% of cases, symptoms appear only after it has spread to other organs. Kudo notices something about 5 minutes into the examination. It's a polyp, roughly 5 millimeters in size. There are two types of polyps. One is neoplastic, which means it can become cancerous. About 70% of polyps are in this category and must be removed as soon as possible. Non-neoplastic polyps are harmless and can be left as they are. But if they're misdiagnosed, they will be removed, and this increases the risk of damaging the large intestine. The AI-powered endoscope, called EndoBrain, was developed to help determine whether a polyp should be removed. First, the AI analyzes the blood vessels in the polyp. This shows the blood vessels in a tumor that was diagnosed as cancerous. Cancer cells need oxygen and nutrients from the blood in order to grow, so they stimulate the blood vessels, causing them to thicken and get distorted. The AI examines the shape of the blood vessels and immediately decides whether a tumor is neoplastic. The diagnosis takes just 0.4 seconds. It's rarely wrong. Some lesions can be difficult for doctors to diagnose properly, but it's easy for the AI-powered endoscope. Kudo is examining a female patient. He sprays a special pigment to highlight the boundary between the membrane and lesions, if any. Kudo notices a tumor that appears for a second in the upper left of the screen. Here's the same video clip in slow motion. The tumor is circled in red. The tumor has merged with a fold in the large intestine, making it difficult to detect. The AI examines the tumor from various angles and concludes that it's highly likely to be neoplastic.
今度はもっと倍率を上げて500倍まで上げていって細胞がどうなってるかっていうのをちょっと見ていきます。
Kudo needs to find out how serious the tumor is. He uses a powerful, state-of-the-art magnifier to view it at a cellular level. The nucleus of a cancer cell is large and distorted. That's what the AI looks for. To make a correct diagnosis, a doctor must have experience analyzing countless images of lesions. It's very difficult, especially for newer doctors.
やっぱりポリープ一つにしても右から見た図左から見た図見た目が違ったりもありますし、写真だけだとわからないことばっかりで実際の患者さんごとにいろいろ違いますし。
Until now, cellular level examinations required doctors to cut a section of a lesion and look at it under a microscope. But the AI-powered endoscope enables them to make a diagnosis instantly.
Dr. Kudo, thank you so much for your time today. I know how incredibly busy you are, so it's such a pleasure having you on the program, so thank you so much.
ありがとうございます。
What prompted you to develop this endoscope?
Until now, it would take a week to 10 days to do a biopsy, find out whether a tumor is cancerous, and determine a course of treatment. This would be very stressful and tiring for the patient. But with the AI-powered endoscope, we have a diagnosis as soon as we're done with the examination. This has been our dream for a long time, and it has finally become reality. In just 0.4 seconds, we find out whether a lesion could be cancerous or not. Patients no longer have to waste their time worrying about whether they have cancer or not. I think the AI-powered endoscope is revolutionary.
And Dr. Kudo, what's probably the biggest advantage of using AI?
Artificial intelligence rarely makes mistakes. Inserting and manipulating an endoscope just takes getting used to. But to make a diagnosis, you must have knowledge of pathology. And when you do a biopsy, you can only remove one small section. So you must know what abnormal cancerous tissue looks like. AI can look at the entire surface and examine the most atypical part. The AI-powered endoscope makes a quick and accurate diagnosis possible. We didn't have that before.
This system was developed by Kensaku Mori, a specialist of computer science. In doing so, images of various lesion patterns were necessary.
主要の画像の特徴的なパターン、それから非主要の画像が持っている特徴的なパターンがあります。で、それぞれが持っている実は模様の違いを AI の方が学習をして、そして答えるようになっているんです。
These cells come from a polyp that doesn't need to be removed. This is an adenoma. It's a type of tumor that can become cancerous. And this is cancer. Each lesion has a unique pattern that is created by its cells and blood vessels. Mori fed 60,000 images of various lesion patterns into the AI. This allowed the system to make highly accurate diagnoses in an instant.
エキスパートのドクターとほぼ同等レベルのですね、精神質になっているというふうに聞いております。 大量のデータを学習することによって上がっていく可能性も十分にあるというふうに考えています。
Cellular level diagnoses became possible thanks to a super magnifier developed in 2018 for endoscopes. It magnifies up to 520 times compared to the maximum 100 times for regular endoscopes.
ここに日本のお札があります。
This is how it looks when the circled area is magnified 100 times. Next, it's magnified 520 times. The tiny letters are clearly visible.
So that's 520 now? That's amazing. So you could actually see the fibers. Staggering.
顕微鏡でしか見えない像が一瞬のうちに見えて、そしてそれが診断に直結するような所見を得られるというのは、医学の進歩の究極の医学の進歩。
I mean, from 100 to 520 is a big jump, and it's in a very short time, hasn't it been?
Structural abnormalities can be detected at a magnification of 100 times. But to diagnose a cancer, cellular abnormalities must also be checked. It's not possible to see blood flowing in removed tissue, even with a microscope. But with the ultra-magnifying endoscope, you can see cells and their nucleus, blood vessels, and the flow and speed of red blood cells. This has significantly improved the accuracy of diagnoses.
So in essence, is human skill probably not sufficient?
About half the doctors who use endoscopes are expert practitioners, and the other half are novices. Diagnoses can vary widely depending on their experience and skills. Detection and diagnosis is best done by whoever's familiar with all the data. That means artificial intelligence is the best option.
In Japan, another endoscope is being developed. It's also equipped with AI, but has different functions. This video clip was taken with it. As the camera is pulled out, a small circle appears on screen. A close look at it shows a small polyp-like lesion. The AI lets the doctor know the location of lesions that require further examination, acting somewhat like a car navigation system. Medical doctor Masayoshi Yamada developed this AI-powered endoscope.
AI っていうのはもう隅から隅まで全部確認してくれますので、まさに見逃しを防ぐものだと思いますよね。
The AI has studied more than 100,000 images of lesions and of healthy large intestines using a technology called deep learning, and on its own, it has become able to distinguish between what's normal and what's not. This is a depressed type lesion. Even experienced doctors tend to miss it. Other than slight redness, it doesn't look different from other areas.
関節病変というのは小さくても進行が早いっていうふうに言われています。基本的には赤いです。基本的には赤いところを探せばいいと思うんですけども、難しいですよね。
The new AI-assisted endoscope managed to find the cancer in just 1/10 of a second after the image was shown. This AI was fed nearly 5,000 images of large intestines with and without a lesion. It was able to identify 98% of the lesions.
AI を使うことによって、その診断学をもっと伸ばすことができる。もうみんなが診断学はもうベテランクラスまですぐ行くことができるっていうふうに思ってるんですよね。
Many colorectal cancer patients die because their cancer often spreads to other organs, like the liver and lungs. It's called remote metastasis. This happens most commonly with depressed-type cancers because they spread at an early stage. In Western countries, very few doctors can detect depressed-type cancers. Many think simply removing polyps is enough. But that won't reduce the death rate of colorectal cancer patients. Medical professionals around the world are starting to realize that.
But Dr. Kudo, I understand as great as technology is, you need to have a level of skill, I would imagine, as a doctor. I mean, how important, obviously, is the skill as a doctor versus the technology?
To find cancer in the appendix with a colorectal fibroscope, you must be able to guide the device all the way to the organ. That takes about 6 months of training. In addition, you must know how to diagnose a lesion and how to treat it. You must possess these 3 skills. Without them, you cannot provide patients with sufficient medical care.
Dr. Kudo, do you think that your endoscope using AI is going to contribute both obviously in Japan to the medical field of Japan of endoscopy, but also worldwide?
A diagnosis doesn't change according to race. It's the same around the world. So, I think this device will help to significantly improve the accuracy of doctors' diagnoses worldwide. This will eventually lead to improvements in treatment everywhere.
Thank you so much.
どうもありがとうございます。
Innovation is also underway for endoscopes used in laparoscopic surgeries. The aim is to improve operational safety. This endoscope uses 8K super high vision technology. It was co-developed by Japan's National Cancer Center, a Japanese optical equipment maker, and NHK. This is a video clip of a pig's small intestine taken with the 8K endoscope. The blood vessels have a 3-dimensional bulge. The capillaries also look natural. The red parts stand out and look unnatural in the image taken with a standard endoscope. The blood vessels also look flat. When magnified, the standard scope image looks grainy, but the 8K scope image remains sharp and shows the details clearly. The 8K endoscope is going through clinical trials for colorectal cancer. Doctors have tried using the device in 25 laparoscopic surgeries.
これみんな神経です。こういう白い筋がスーッて。
Thanks to the super sharp images, doctors can clearly see very thin nerves like these. Around the rectum are many nerves involved in bowel movements, urination, and reproductive functions. The 8K endoscope allows them to be identified clearly. It's expected to help reduce complications that could cause dysfunction. With the 8K endoscope, there's no need to move the camera closer to the affected area. With a conventional endoscope, doctors need to move it towards the area they want to see in detail. And when they do so, surgical tools will no longer be visible. There's a higher risk of damaging surrounding tissue. However, the 8K endoscope allows doctors to digitally zoom in on the part they want to see and also eliminates blind spots.
ちょっとずらしてね。こっち見えるように。
The operating surgeon simply needs to give instructions on which area he wants to see. He can have a magnified image on the monitor without moving the camera. The surgeon can check two different images while he operates. One is a close-up, and the other shows the entire surgical site.
みんなの監視がこういうふうに見えて干渉しないことがこれ全体に分かってカメラと監視で変なところを触ってないっていうのも分かりますので。
The images are very sharp, so even slight bleeding won't be overlooked. In the clinical trials, the doctors were able to limit bleeding to about half the average of conventional laparoscopic surgeries. However, there are still issues such as the camera's weight and the device's operability. The developers aim to put it into practical use within a few years.
Today on the program, we're going to be learning about fermented foods, which is an essential component of Japanese cuisine. And these fermented foods can help boost our gut microbiome or our gut flora, and they can also improve our overall digestive health. And today on the program, we're joined by Professor Kenji Maehashi, who is an expert in fermentation. Professor, thank you so much for your time today.
We'll introduce two types of fermented foods that Maehashi recommends. They're easy to find if you visit Japan. The first is vinegar. It's available anywhere in the world, but many varieties in Japan are made with rice or other grains.
I'm so interested in how this tastes. Kanpai. I wonder how it's going to taste. Wow, that's a great combination of it. It's quite a very subtle ginger with the vinegar.
お酢というのは、お酢の酢酸という成分が、内臓脂肪を減らしたり血圧を下げてくれるという働きなんです。それは1日にたった大さじ1杯15ミリリットル飲むだけでそれは健康効果が現れます。また血糖値が上がるのを防いで、高血圧を防いでくれます。それともう一つ、稲毛さんに飲んでいただきたいお酢があるんですよ。これです。
What's this one?
黒酢です。玄米で作られます。
This black vinegar is fermented in earthenware pots for over 3 months. Compared with regular rice vinegar, black vinegar is richer in amino acids, which provide the body with energy, and contains more melanoidin, a strong antioxidant.
Wow, that's got a really nice sour kick.
Next is koji, or malted rice.
お酒だけじゃなくて、お酒に欠かせない麹、米麹。
Koji, because I think the basis of most Japanese fermented food, whether it be shoyu, sake, amazake, it's all koji, isn't it?
麹は酵素の働きでできたオリゴ糖などが入っていて、それは体の中で腸内細菌の餌になるんですね。そうすると腸内細菌が活発になって腸から健康になるということです。
So this is koji here, right?
そうですね。僕のおすすめはこの塩麹ですね。塩の代わりにこれを使うと麹菌の酵素が働くと肉を柔らかくしたり旨味を作ったり美味しくもなるし、また健康効果も高まります。
If you can find koji or malted rice, you can easily make it at home.
これが米麹と塩と温めたお湯ですね。材料はこれだけです。まず塩をお湯に溶かします。米麹はこういう塊の場合には必ず一粒一粒になるようにほぐします。食塩水を加えます。
Knead the mixture thoroughly and leave it at room temperature for a week to 10 days. Mix it well once a day to promote fermentation. You can add herbs like rosemary to enrich its aroma. You can also mix it with olive oil and lemon juice, for example. That's a simple way of making a salad dressing.
エリカさん食べてみてください。
じゃあいただきます。It looks beautiful. It's such a great combination with a faint sort of the fragrance of the rosemary with the olive oil and the avocado. And it's got a slight umami flavor, but it's not overpowering.
Koji is also used to make amazake, a healthy drink that Japanese people have long enjoyed.
海外は特にアメリカでちょっとブームになってきて、
グルコースというブドウ糖というエネルギー源を持っているのですごく健康にもいいですし、飲む点滴と言われています。
This is amazake mixed with roasted green tea.
いただきます。Wow, that's a great flavor. Because the roasted tea is actually overpowering the sort of sweetness of the amazake.
お茶が入っているのでポリフェノール効果で、甘酒の効果と合わせてやはり抗酸化力が強いということになりますね。
Erica has also come up with an original recipe using amazake.
Today I've got blueberries, banana, and also soy milk. And that's the base of the smoothie. So this is obviously soy milk. And the amazake. Even with the blueberries, actually, when you flash freeze them, the anthocyanins or the wonderful polyphenols stay really, really stable. So you're getting the amazing benefits of blueberries as well. And banana gives it that lovely sweetness and richness too.
Just mix the ingredients in a blender and it's done. You can use mango or other fruits in place of blueberries if you prefer.
いただきます。わあ、綺麗ですね。見た目も。
どうでしょうか。
甘さがちょうどいいですね。それにこれ豆乳が入っているというのもいいですね。イソフラボンが入っているんですけども、腸の中では腸内細菌の力でエコールという物質に変わるんですね。そうするともっとイソフラボンの効果が上がるので、甘酒と合わせてとてもいいと思います。
Great, thank you so much for your time today. ありがとうございました。